Good morning. For those of you scrambling to get back from morning tea, welcome back. I certainly enjoyed the first session this morning. I think that it set a really great position for the rest of the day. So, and I, of course, have got the most exciting session to chair because we're talking about globalisation, trade and work. And I think this is where we take stuff and we move it from beyond our borders to what's happening in the world, to thinking about, well, what does that mean for us back here in little old Australia, but also for us in shaping and reacting and leveraging opportunities to work towards equity. And for those of you that don't know me, my name's Ross Womersley and I'm the CEO of the South Australian Council of Social Service, and we're about justice and fairness and equity, and we're the peak body for social and welfare and community services in South Australia. So this stuff is right in the middle of my heart, because in fact understanding how the intersection between a whole lot of stuff that happens in the world goes on is really important. Now, we are running a little bit behind time, so I'm going to move us along, and I'm not going to... You're going to hear from Dr. Ashley Schramm. Now, I'm not going to read her bio. You can find that in the program. She has certainly a high standing. And after we've heard from Ashley, there'll be an opportunity to hopefully have a few questions. And then we're going to go on to three presentations that from Catherine Brown-Young, Miriam Vandenberg and Belinda Townsend. And so we'll move through those, and by the end of it, I think we get to have lunch. So it won't be that long until lunchtime. It will be a fascinating conversation. And this first one from Dr. Ashley Schramm actually focuses on trade and health and the intersections, the pathways to health strategies and ideas. So I'd like you to join me in welcoming Ashley to the stage.
Okay, so I'm going to be speaking about our work that we've been doing on trade and investment policy. And this is research that's been led by myself and Dr. Belle Townsend in collaboration with Sharon and Fran and Ron Labonte, who's not here today. So briefly, I'm going to say, why did we actually invest our resources and energy into trade and investment policy? Most of my presentation is really going to be focusing on what we learned in the research that we did. And then at the end, I'll just briefly speak to some ways forward for research, policy, and advocacy. So I recognize that trade and investment policy is probably not something that a lot of people in this room work with a lot. And because I want to focus this presentation on actually saying this is the new information that we've generated through the CRE, I don't have the time to really unpack why trade and investment matters for health and all those different pathways. But I do kind of want to give you the impression of why this forum is actually so important. Because from a social determinants of health perspective, like Fran was introducing at the beginning, this is actually a space where you really have the opportunity to redistribute wealth and power. It's a really upstream policy factor. And the reason it can do that is because trade and investment rules can shape economic and development policy. They shape the products and services markets that we experience every day. They can shape access to medicines and the level of privatization of healthcare, and just a whole host of rules and regulations. And some people like to ask, okay, so is trade investment good or bad for health? And I think that's not actually a question that we can answer, because we've already been talking about its winners and losers, and there's a lot of nuance to all of this. But having a trade and investment system in and of itself is neither good nor bad for health. What it's really about are the ideas and the values and the actor interests that actually sit behind and design the system. So what is the system doing? Whether or not it's what type of economic policy it's producing, and how those benefits are being distributed. It's about, can the system actually distinguish between public goods and public bads? And is there a way to actually account for health and well-being of those products and services, or is everything just an equal product in the eyes of the system? Does it actually seek to share the benefits of knowledge and technology? Or is it just, can we actually look around at global health needs and say we can apply this knowledge that some countries have to actually improving the quality of life for everyone? Or is it just another way to actually commodify and monetize health? And finally, is it about, taking all of these countries and bringing everyone up to sort of the best practice standards that we have? Or is it really about another way of creating competition, getting countries to compete for corporate dollars, potentially by sacrificing on standards around environment, labor, or health? And so that's a really high-level way to say, I just want you to understand that this space, this forum is really important. Just about every pathway you could think of how the larger macroeconomic policy space affects health, trade and investments in that area. So we think it's a really important space to be engaging in. And our efforts in this project were focused on building evidence for the effects of trade on health, understanding how different actors are actually framing their interests in this area, potentially the different strategies between those market actors and public interest actors, and then trying to understand that, so we have the knowledge that medicines and tobacco have quite successfully become issues within the trade investment space, and then trying to understand how did that happen, and maybe what are some of the lessons to broaden up to a larger range of public health issues with a focus on alcohol and nutrition. So one of the areas that's received a lot of attention in the trade and health space are the commercial determinants of health. And so a lot of evidence has been looked at and being produced around the nutrition space, around tobacco, but one of the big gaps still was alcohol. So we thought, okay, well, there's actually something that we can be doing in here and do one of the first empirical studies on the effects of trade on alcohol. And so how we did this is we looked at the impact of signing a preferential trade agreement with Australia, and then in turn on the volume of alcohol that Australia was exporting to its 16 countries that it has a preferential trade agreement with. And we looked at the impact of the agreement itself. So you sign on to the agreement, what are the effects of that? And then the actual specific level of tariff rate reductions. And a tariff really being a border tax. So what is the tax if you are going to import an alcohol product into your country? This is the tax that gets levied at the border, which is in addition to the sort of excise taxes that we're more familiar with, or sin taxes as some people call them, that all happen equally to all products after they've crossed the border. But what's interesting is that Australia, a lot of its key trading partners actually have large segments of their population that don't consume alcohol. And so what we did is we split our data into two models. So those countries where less than 50% of your population is abstaining from alcohol, and countries where more than 50% abstains. And truthfully, one of the reasons we separated this is actually because I thought that those countries where there's a high level of alcohol abstinence, that we weren't going to find an effect there. That it wouldn't matter if you started to sort of slowly reduce the cost of these products if you have these really entrenched cultural and religious barriers to alcohol consumption. So that was sort of what drove that decision. What did we find? Basically, that trade liberalization, it does in fact increase the volume of alcohol that Australia is exporting to its partners, and that's kind of not really surprising. I think if we had a trade investment audience in the room, they'd be like, well done, that's what these agreements are supposed to be doing. So that wasn't really a surprising finding. But what was less obvious is the fact that what this was doing, it wasn't just acting on the volume of alcohol that was being exported, it was actually acting on the diversity of products. So these agreements were actually introducing trade in products where no trade had previously occurred. And so that's interesting because it means it isn't actually just impacting how much countries are drinking if they're trading with Australia, it's actually changing what they're drinking. Right. And so this is really interesting because it depends on what those new drinks are that are entering the market. So if we see more of these ready-to-drink products, right, those tend to target women and youth. Or if we're seeing alcohol that's been premixed with energy drinks, those tend to increase drink driving and assault. And so that's something that we have to look at next. So now we understand, okay, it's not just volume, it's a diversity of alcohol beverage, and that opens up a new set of questions for us. And the second key finding was that actually where these agreements had the biggest impact was in countries where the populations hadn't been drinking. So in the long run, it was good that we separated out these two models so we could find the impacts, but it was for very opposite reasons than what we had actually intended. And it's not too hard. I mean, once you see that, you can say, well, it's kind of easy to rationalize, right? We've seen this with tobacco and food industries. They go in and they target countries where there's a large room for emerging markets, and they know that they have a consumer base that they can grow. And when we did a little extra digging, we saw that actually there's a number of large alcohol multinationals that had gone in and started to buy up smaller companies in the region. And in their corporate reports, we saw some language. They are talking about these large-scale activation campaigns that they were doing in Malaysia. And so Malaysia actually is a really tough regulation where there's advertising bans on certain populations actually consuming alcohol, and they're kind of bragging about the way that they go about this by doing these exclusive parties that they bring the youth in. So that's, I think, a really important area to watch. But overall, what this project did is it gave us new evidence to understand, how alcohol as a product is actually responding to trade investment liberalization. So then we've been studying how agenda setting happens in this space. So great, we're building the evidence base. Well, how does that actually get used when it comes to setting the agenda? How are people framing their arguments? Is evidence, what we hope? Is it going to matter, and how does it get used? And so the first area we looked at was framing. And so this is really, how do different actors who want to influence the trade and investment agenda, how are they trying to get policymakers and negotiators to think about the issues in this space? And what we did is we looked at submissions that were made, and these were all public, around the Trans-Pacific Partnership Agreement, or I'm just going to shorthand TPP. And we found there were three key frames that were used. The first one is one that we're probably all very familiar with, which is this dominant neoliberal market frame. And the argument here basically goes, markets are absolutely the most effective ways to develop society, so you should have these trade agreements that allow markets to run free, and then from that, the riches will flow basically to everyone down the line. The second frame we saw was state sovereignty, and the argument here went more along the line of these agreements are actually chipping away at government's ability to run its domestic affairs the way it wants to. So states are losing control, and we need to rein that in terms of these agreements in order to allow states to protect their populations. And the third frame was this, what we're calling a public interest frame. And it drew more attention to the fact that these agreements were privileging the interests of the few over the many. It's where you saw ideas about corporations are really the ones that are benefiting the most here, and reminding states that they have a duty of care and that these agreements are potentially getting in the way of that. And so the state sovereignty and public interest frames obviously sit a lot more comfortably with each other, but there's just a slightly different emphasis on what they're driving home in the responsibility. Now, perhaps unsurprisingly, some of these frames are better or worse for making health equity arguments. Now, we saw within the neoliberal market frame, there was really no discussion of equity at all. We don't see people making those kind of arguments. Perhaps, if anything, it would be about equitable competition and wanting to open up those spaces, but there was nothing in terms of health or society. In the state sovereignty frame, we saw a few equity issues, notably around access to medicines, and that as an equity issue comes up, and a few instances of starting to need to protect vulnerable populations, but it was quite limited still. And it was really in the public interest framing where you see that space really open up for issues of equity. We saw arguments about human rights, civil liberties, and actually broadening that discussion about equity-related issues like wealth distribution and how are these agreements changing that. Not within health issues, really only access to medicines is the one that ever really gets an equity framing, but at least in public interest, you start to see equity in the larger social determinants of health actually coming into the discussion. But so for us, from a health equity stance, strategically, the public interest framing is the strongest for us. Then we looked at, okay, so how do these different groups actually start to use strategies when they're making submissions? And one of the strategies we were interested in is how do you exert authority? And specifically, we looked at the literature, and there's these different ways that you can actually try and assert authority. And simply, you have this idea of network authority, which is power in numbers and unifying your voice. You've got institutional authority, which is about saying, I'm someone important, listen to me. Legal authority, which is all about the laws on my side. And expert authority, which is basically saying, I have evidence to back this up. And what we did is we contrasted those people that were making submissions who really held that dominant neoliberal market framing and how they use authority versus all those people that were making submissions under the state sovereignty and public interest framing and how they try and assert authority. And what we saw is that it's really in the counter frames where people are using networked authority and trying to actually amplify their messages, saying they were citing each other, we're in agreement, trying to say there's more of us here and we think this sort of counter position to what you're doing. Institutional authority, definitely a tactic of market actors, trying to basically establish clout, look at all the people I know, look at all the groups I sit on, they listen to me, you should listen to me too. To a certain extent, they used legal authority, but in a very narrow way. It was mostly talking about previous agreements as models. So, we're negotiating the TPP, this partner's given this to another country in this other agreement, that should serve as a model provision. We want you to bring that in. So it's quite narrow the way they did it. Whereas this tactic was also used by counterframes, but in a bit more diverse way. Sometimes they were saying, yes, look at what happened in a previous trade agreement and this unintended negative consequence that happened, so we should protect ourselves from that in the future. Or a lot of times they're actually drawing attention to international legal obligations that states had, particularly around human rights, environment, and health, and saying, hey, you've got these other treaties that you've signed on to, you've got these commitments, and don't sign something in a trade agreement that's actually going to undermine those. And then the last, evidence, we really see that primarily in the counter frame. Particularly, it's really only these groups that draw on the scholarly work that we're hoping is getting out there. And the dominant market actors, they've got so much legitimacy and authority in this space, they don't really need to cite their source. Sometimes they throw out a bit of market data or trade data, but they're really not worried about justifying their position because they know that that's the conversation that we're already having. And the last bit that I'm going to talk about is what we learned about so medicines and tobacco, why they've become a trade issue, and how we might learn something from that to sort of broaden up the scope for other public health issues like alcohol or nutrition, but ideally in the future even being able to go, of course, beyond those. So with access to medicines, there was a lot of reasons I think you can look at and say this is why this has become a trade issue. It has the frame alignment, right? So that's one of the things that we've really been looking at. And within access to medicines, it really follows the trade rationale. So trade is supposed to allow goods to move freer. But when you have patents being introduced, that's actually a restriction on markets, right? And so what we're arguing for in the health space is more product to more people for a better price. And that really sits comfortably within the trade and investment logic, so it's easier for us to inject those arguments there. The idea of path dependencies is that the way something's already been treated means it's more likely to be continually treated like that in the future. And so access to medicines has previously been a trade and investment issue, and I'm just going to park that until the exogenous event to say why that actually was. Also the amount of treaties and legislation that occur around an issue. So we have, like a lot of countries here in Australia, there's the pharmaceutical benefit scheme. So you've got this domestic piece of legislation to say this is an issue. And so it gives it a bit of weight to say this is something that you should be interested in. The evidence is really easy to make in this space, right? So you've got this clear causal chain that you can talk to policymakers about. You've got this drug. If you give it another year of patent extension, it's going to be another year at this higher price. This is how many people are on the drug. We can calculate per year what every year of extension of patent rights is going to cost you. And so that's a really great argument to be able to go and make for policymakers. Then there's this idea of whose interests in exports, right? So in Australia, not a huge exporter of medicines or even IP more broadly. And so we don't have a lot of export interest there. So what it really does depend on is which partners that Australia is engaging with. So when you see them in negotiations with the US or EU, that's where it starts to become a little bit more contentious, and they've got a reason that they're pushing stronger IP rights. But then what's really interesting and important are these exogenous events. And in this case, it was the HIV/AIDS crisis. And what that did was it showed that actually patents under the World Trade Organization, so under trade and investment rules, these were actually standing in the way of people, primarily in developing countries, getting life-saving medications. And so because we could connect that issue to a trade and investment agreement, it firmly planted it as not just a domestic health issue. This is now a trade issue. And so that, when I was referring to the path dependencies, out of that there was a special agreement under the World Trade Organization that now actually promotes the access to medicines specifically within developing countries. So then it's again easier. All around you can see how these factors start to come together, and access to medicines is clearly a trade and investment issue. Tobacco has quite a bit going for it. You know, we're actually talking about getting rid of a product so it doesn't have the same market logic. There's no real history of tobacco being treated differently within the system. Legislation-wise, having the Framework Convention for Tobacco Control, a lot of domestic programs around tobacco control gives a good rationale for saying this is a product that we can treat differently. The evidence is quite in at this stage for tobacco, and a lot of developed countries don't really have big export markets, so you don't see as much domestic pressure to protect this space. And the very interesting exogenous event there. So what took tobacco from being a health issue to a trade issue? I think to a certain extent we can actually kind of thank Philip Morris for that. Because, yeah, it's a bit of a perverse rationale, but for a long time, health advocates had been saying, we have these agreements that corporations can use to challenge domestic health regulatory policy. But for a long time, there was just the people that were using those systems were corporations we'd never heard of, that were using these breaches of contract and rules we had never considered. And so it just didn't really capture the public's imagination. But when you had Philip Morris, which was a household known name, not a great public reputation, and the fact that they were challenging Australia over tobacco plain packaging legislation that people could really understand, it took tobacco from being a health issue to a trade issue. Now, you know, looking at all of that, it's a little bit more difficult to say what exactly is going to help with alcohol nutrition, and because I know I'm a little bit running out of time here, I won't necessarily go into this too specifically. But I think the good thing, what comes out of this research is at least we can start to say, well, these are the factors that we've understood have probably been important in whether or not access to medicines and tobacco got up, and we can start to think, well, what sort of movement would we need around nutrition and alcohol in order to get these to actually start to move from the domestic health arena into the trade and investment arena, you know, potentially getting more legislation, continuing to build that evidence base. Not quite sure what our exogenous event is going to be that's going to get it up, but at least we can start to be looking out for those. And so just to quickly wrap up in ways forward, in terms of research, there still is that need. You know, we've now understood some of the different frames and strategies and authority that happen in this space. What we need to understand is then how effective is that in actually guiding and shaping the agenda. And there's still a lot of work that can be done around the social determinants of health and understanding how trade and investment actually shapes those. For advocacy, we're just trying to think about how to sensitize or socialize a broader range of health issues into the trade space, that it's not just access to medicines, and looking at those factors that will allow us to open up that more broadly for public health. Retaining this commitment to public interest frames, those are going to suit us best when we try and put forward equity arguments, and then expanding and strengthening the network of actors that have the capacity and engagement in the trade and investment space, which is something that we're actively working on. And then for policy asks, basically, if we were actually able to get some sort of commitment to health equity impact assessments before the treaty sign, not after it's all done, and ideally by an independent third-party group doing it, and then trying to figure out how do we actually get people to think that, you know, some of these like tobacco, alcohol, ultra-processed foods, they aren't just ordinary commodities and they shouldn't be treated as such in these types of agreements. Thank you.
One person's got one opportunity to ask the killer question.
No pressure.
Have we got a killer question?
I think the bar's been set too high now.
All right. Oh, we do have a killer question.
Yeah.
Just wait one
I'm going to ask, sorry, it's not a killer question, but if no one else is going to ask, I will ask something. Just in terms of the way forward at the end, let's say we do manage to get health impact assessments embedded in international policy like this. maybe for covering later in discussion, if not now, how can we then actually use that to make sure that that then leads to actions and policies at the state and domestic levels, I guess, because having the policy there doesn't necessarily mean action.
Yeah, no, I completely. So I think, you know, if we were actually able to get that level of commitment before agreement was signed, because right now we're always doing them after. We don't have any access to those texts, so we don't know what the problems are until it's too late. At least if you were able to have those being done before an agreement signed, there's more space to find, well, how could we potentially mediate those impacts? So I think it would just, not necessarily going to lead to perfect policy by any means, but it would actually give a chance to identify some of the, you know, potentially inequitable effects of these agreements. And, you know, we've got a whole host of solutions ready to go, and it would be about then bringing in our understanding of agenda setting, but having the time to actually say, well, maybe there's something we could do to help out these agreements before they're already in place.
All right, thank you, Ashley. Sorry, it's a bit of a scramble. Thank you for scrambling through the end of your presentation as well. So the next three presentations come at the issue in a slightly different way. Catherine Brown-Young is going to talk about the changes to employment. Miriam Vandenberg is going to talk a little bit about informal work. And Belinda Townsend's going to talk about paid parental leave. Now, I'm going to invite them in, again, in the interests of not actually using up lots of time. I'm going to point you to the program for their bios, which are extensive. And in the first instance, Catherine, would you like to come up and join us? There she is.
Okay, thank you, Ross. Well, I'm going to talk, drill down and talk about a case study. And so I was looking at the impact of the Holden closure here in South Australia and the policy response and how it affected health equity for the Playford community. And so hopefully what I'm going to cover today, I'm going to talk a little bit about South Australia and also about the case study area of Playford. Then I'll describe the methods we used and share some of the key findings we found, and then hopefully generate some discussion points. So I'll start with South Australia. Now, Fran has already mentioned health inequities in South Australia. And this graph here shows a comparison of the age-standardized premature mortality rate per 100,000 across 2 time periods and also across the 5 quintiles from the least disadvantaged to the most disadvantaged. And you can see here that health overall has increased across the 5 quintiles. But if you look between the least and the most disadvantaged, you can see that the health inequities and the gap between the quintiles has increased, and that you're now actually, if you live in the most disadvantaged quintile, over twice as likely to die prematurely than if you live in the least. And then looking at the context of when the General Motors Holden was announced its closure in 2013, that it would close in 2017, you can see that South Australia was facing considerable economic headwinds. South Australia as an economy is a small economy with an aging population, and it was considerably affected by the 2008 global economic financial crisis. And so the context of the closure was very much that of an economic emergency and an economic crisis. And then in terms of what was the economic shock from the General Motors Holden closure, well, there was some economic modelling done prior to the closure, and taking a business as usual scenario, it was estimated that over 13,000 jobs would be lost, and that included the supply chain businesses and also other commercial businesses associated with the automotive industry. However, there were a lot of interventions over the period, because there's a 4-year period before the closure, and so it was expected that job losses more around 6,000 jobs. but then you have to consider the effect on the affected communities. And they lost a large employer, and also those early entry jobs for young people, and training. And if you look at this photo here, this image, this is a nod to Holden's early beginnings as a saddle maker. So then, looking at the case study area of Playford, and the Holden factory was located in Elizabeth, which is in Playford. Playford's a rapidly growing local government authority. It's got a young population, and it's also got considerable areas, pockets of disadvantage, as indicated here in the socio-economic index for area, which a low number signifies disadvantage, and it's 855. And it's also got significant, stubborn unemployment rates, and particularly high unemployment rates for young people, and of course very high rate of children living in poverty. So what we did in this study, there were 3 components to the study. The first part was the policy document analysis of South Australian Government's policy response to the closure. And we used a Backy problematization approach, where we looked at how the closure of General Motors was problematized within the framing of the policies, and what the assumptions were regarding the closure, and where what was left unproblematic, or where the silences were. And we also carried out a number of workshops within the community, and then did some in-depth interviews. And I'll talk about those last 2 a little bit later. I'll focus first on the policy analysis. And here you can see a time frame of the policy responses to the closure. And we've divided it into federal, state, and local government, but we concentrated mainly on the state level response. And in 2014, the Our Jobs Plan was released by the government, and this established the Automotive Transformation Task Force, which was essentially devised to support workers and transition to new jobs and get them credentialed. The Our Jobs Plan also had some schemes to help the affected communities, and also to diversify the the supply chain businesses, and also to generate some infrastructure projects to create jobs for people who'd be losing their jobs. And at the same time, there were 10 economic priorities released, and these were to guide really the economic project of the state government at the time. And then about a year prior to the closure of Holden, the Northern Economic Plan was released. And this had 3 main focuses, and that was to intensify or grow existing industries, and also to promote thriving communities through resilience programs, and to free up government red tape, and to generate innovation. And at the local government, there was a transformation underway of the government through population growth, and also transitioning to more of a service-based industry away from advanced manufacturing. And local governments received some funding through the Our Jobs Plan to regenerate their central business districts. So if I move on now to our policy analysis and what we found, and looking at how the policies were formulated, we found that there was a very narrow policy frame around jobs and diversification of supply industries around the auto industry, very much an economic focus, and we found an absence of social and health equity. And job creation was mainly targeted around the auto industry. Community programs that we identified were already in place, and the governance was very top-down, and the federal policy response was very programmatic in that they supplied, or they offered funding to the affected states to then distribute. So I'll just go on now and talk about the second part of our research, which was looking at, we took a systems thinking approach and we did some workshops in the community. And we did 3 workshops, 2 with a range of policy and community service providers, both from the state, the local government, and also non-government organisations. And we also included members of the Automotive Transformation Scheme. And then we did a final workshop with community residents. And we took a systems thinking approach and we asked our participants to map out what they thought the key issues were affecting the Playford community around the time of the closure, and then to think through how the closure would actually affect these issues and think more. And we used a very iterative process then of discussion and co-production of several other maps to look at how you could map out what the system was in terms of what was happening on in the community and also was going to happen after the Holden closed, and thinking more about other social determinants of health that might be included. And these here are 2 examples of the individual maps. And this here is the final sort of blended causal loop diagram, and I don't expect anybody to make any sense of this in the short time it's going to be up on the screen. But what I would say is that our participants identified economic investment, training opportunities, and job opportunities as the key 3 areas that would be affected following the Holden closure. And I'll just look at this part here, this subsystem of training opportunities, just to give you an idea of how we work through this. So the issues that were pre-existing in Playford when we did these workshops were around, especially in this youth one, in this youth subsystem, were around enabling school retention and also preventing disengagement of young people. And this was caused largely through intergenerational unemployment and lack of role models and other conditions that were operating in the community. And there was also another concern that the actual training that was available in the community wasn't necessarily preparing or equipping young people for the transition to new jobs, that the training wasn't necessarily transferable. And so the concern was that all these issues, when you had a rise in unemployment due to the Holden closure, that the young people would be pushed out and they'd be sort of not necessarily next in line for jobs in the community, and that they would end up on welfare and fall into poverty and then lose hope for the future. And of course, all of this system here then was part of the other system that I showed you. So there's lots of other stocks and flows that would interact to create health inequities for these young people. So I'll move on now to the final part of our data collection. And we did 31 in-depth interviews with a range of policy and community service providers and policymakers, both at the state and local government. And we also undertook some community resident interviews. And at this point, we tried to include some young people, so we had a youth voice in our data. And we did some data analysis, thematic analysis, and I'll share with you now some of the key themes that we identified. And I've used some quotes which were fairly typical of what people were saying, just to demonstrate what the theme. So there was a narrow policy. The problem was narrowly defined. And as the state policy stakeholder said, the strict measure was jobs. And that's what we found in our policy analysis also. The community-based interventions were perceived to be very ad hoc and reactive. And as the state policy stakeholder said, that while they didn't have any preventative sort of strategies in place, but they recognized that they needed to have something like a 3-month plan and to be reactive. And they were anticipating family breakdowns and mental illness, but there wasn't actually any preventative measures put in place. And from a community service provider perspective, they felt that the policy around health equity, that there was nothing new there, that what was most of the strategies were already happening and they might have been rebadged, but they were happening regardless. And then there was also that tension between the state short-term approach or strategies and the more long-term vision. And again, that policy window that we spoke about earlier, where you've only got that short amount of time to react. And this local government stakeholder, spoke about what happens when, the media attention is gone, when it's no longer a hot political issue. Where's the long-term policy response and where's the vision for the community? And that was clearly an issue. Now, another key theme that we identified was collaboration. And there were lots of issues across many different areas with it, both at the state and local government. And here you can see that in this quote, the tension between being, supportive or driving a policy response. And that tension came through a lot in the responses. And here, and this state government stakeholders talking about whether you allow councils to sit on the sideline a little or whether the state government takes responsibility. And it sort of reflects in a way a lack of a regional response. And then when we looked at collaboration also between local government sectors, and this quote here shows that even at the strategic plan, at the agenda setting, that there wasn't necessarily a health in all policies lens across that, and there was all, that struggle to get health on the agenda. There was also a lack of collaboration or issues with collaboration across community service providers due to the contested funding. And that's also an ongoing issue. And then cross-sectoral collaboration was also identified. And in this quote here, the community service provider is talking about the youth labour market and, those other components that you need to include, such as education, child protection and youth health programs, but they're still really being seen very much in isolation and very distinctly looked at in silos. On a positive note, we did find, and lots of our participants talked about the Northern Connections hub, which in the Northern Connections is the office of the state government, which is located out in Playford. And lots of people talked about how positive that was for creating networks. And in this quote, our community service provider said that, lots of people have lots of ideas about what should happen in the north, and they make decisions, but they don't necessarily ever come out. And the Northern Connections was there as an important sort of pulse on what was happening in the community. So if we look on the final theme that I'm going to talk about is political events. And obviously the closure of the whole auto industry was highly politically charged. But we were looking at the short-term electoral cycles and what that did to policy formulation. And if you remember or are aware that when the Holden factory closed in Elizabeth in 2017, it was 6 months before a state election. And employment at the time was a really charged and hot election item. And so that a lot of the policies were very short term as a result. And also after 16 years of a Labour government, a new government comes in, they want to really put their own sort of shape and name on policies, and so a lot of policies were changed. And as this community resident said up here, the dynamics change also, and especially for a lower socioeconomic area. And I should point out that the Northern Connections office was also closed when the new government came in, which was very regretful, as I think they were in charge of the Automotive Transformation Task Force, or at least were very prominent in it. And so they did find a lot of very positive ways of collaborating, which they were hoping to take on into the community at a later date. So they're gone now. So I'd like to now just say a few words about the experiences of the auto workers, because the policy response in many respects has been very successful, especially in the short to medium term, in that there hasn't been a huge spike in unemployment in South Australia, although it is rising a little bit now. But we were lucky in our in-depth interviews that we got a real sense of the experiences of the Holden workers. So while we found that 75% already had found some work and around 40% were in full-time work, that what we were being reported on was that job quality was a real concern for workers, and especially safety in new jobs. And there were some reports that a number of people had actually left jobs because they felt unsafe in them. And there was also concern around insecure work and underemployment. And this data is from the end of last year, but the supply chain workers at that time, there were 1,800 still looking for work, and 48% of them were over 50. And on the right there is a snapshot from the union support group, and you can see here that over 50% were in part-time or casual work. And the quote down here is from a member of the Automotive Transformation Support Team. It's just saying even very soon after the Holden closed that a lot of workers were moving between jobs, and on average they had 2 to 3 jobs. So before I go on to the discussion points, I'd just like to share with you some suggestions made by the policy and community service providers in our workshop about some strategies to improve social and health equity within the community. And they looked at training, and they talked about having more youth learner driving programs and also some adult apprenticeships. And in the neighbourhood sphere, the people talked about maybe using the schools as community hubs at weekends, and then having transport available for children at weekends to attend sporting events. And to improve economic investment, to have more inclusive investment and social and health equity for all within the community. There were ideas about increasing funding for social enterprise and social procurement policies. And then in the community sphere, people talked about having more wraparound services so that you could enhance agency collaboration, and also reinstating primary health services, some of which were cut previously, and having a more no empty house policy, and then with welfare support, reducing the administrative burden. So I'll move on because I'm probably running out of time. All right. So overall, I'd have to say that the policy response really had an agenda for jobs for workers, not necessarily looking at the conditions of employment, and it didn't really have a health equity regional approach. And so with this in mind, I'll pose these discussion points. I mean, how do we ensure that the conditions of employment promote health equity in this current environment of a globalized labour market, where we've got reduced union membership and also changing conditions of work where we've poor regulation, and also how we embed the social and health equity more explicitly in policy formulation, and how we enhance collaboration between between levels of government and across sectors. And the big question, how do we maintain political commitment for health equity? And I'd just like to put this poem up at the end, because this is a reflection of a worker, Peter Rufus, who spent most of his working time at Holden, and this is how he felt about the closure of Holden. I won't read it out because I don't have time, but you can read that.
Now, we're not going to take questions at this point in time, but we hope that there'll be a little bit of time between now and lunch to come back. So hold your questions, write them down, hold them for the next. Now, Miriam, you're in a position to come and join us now, we'll move straight into... This is a presentation looking at the issue of informal work in Australia.
There we go, it works. Hello everyone, my name's Miriam. I'm doing a PhD at Flinders University with Fran and Catherine, and I'd like to acknowledge their support in the work that I'm undertaking there. I'd also like to pay my respects to the Aboriginal people of this country and the elders past, present and future. And finally, I want to really extend a welcome to our Tasmanian colleagues here today. There's quite a few of us, and if you haven't already met one, I invite you to network with them in the breaks, because we're a growing force. I actually live in Tasmania. I also work at the University of Tasmania, but have my home, I guess, my connection to home here in South Australia. So I'm across a couple of states. I'm going to very briefly delve into a type of employment or an employment condition that we know very little about in Australia. Those of you who've travelled overseas will have come across, I'm sure, informal work and seen that quite overtly as a large part of economies, particularly in lesser developed countries than our own. But I want to assure you that it is also a significant type of employment in Australia, and my research has been looking at how people experience this type of employment in our own backyards. So many authors and I guess commentators and writers, not just researchers, but people are writing about the changing world of work. And we're hearing a lot of things nowadays about casualisation of the workforce and precarious work, penalty rates and the experiences of migrant workers, a whole range of different things. And some people will describe the changing world as work as a fairly new phenomenon. I don't have time to debate that, but I would argue that we've always seen these kinds of challenges in the world of work. And it's just that certain cohorts experience them more than others, and perhaps at times it's been more obvious in certain parts of the world than others. But work for a lot of people has never been fair and decent. And what the International Labour Organisation has drawn our attention to is that these types of experiences of employment open up vulnerabilities for people, because they come into a definition of work which is known as unacceptable work and employment. Unacceptable forms of work are defined as compromising conditions that deny fundamental principles and rights at work and put at risk the lives, health, freedom, human dignity and security of workers, or keep households in poverty. Now, definitions around what is fair and decent work do vary around the world, and depending on the kind of literature that you look at. But what we do know is that when people undertake this kind of work, they're experienced to a range of conditions that threaten lives, that threaten their health and their well-being. And the kinds of mechanisms that are drawn into that are things like income, security, working time, so the time that people actually work and the flexibility of that work. When work is unacceptable, workers lose voice and representation, they lose social protection. It impinges on their rights and their dignity in the workplace, and it impinges on legal protection and community and family life and responsibilities. And it also forces people into unacceptable kinds of work, like forced labour, slavery, child labour, and also informal employment. And what this means for health equity, looks like this. What we have in the yellow box is a continuum of different kinds of employment conditions. So for those people who are lucky enough to have full employment, if they have fair and decent working conditions, then they're likely to have better health. But then there are people who are unemployed. There are people who experience precarious conditions, informality, child labour, slavery, bonded labour, etc. And when you put that in the mix with a range of other social and health conditions, you threaten health equity. And this diagram here comes from the Social Determinants of Health Employment Knowledge Network, which did a whole lot of work looking at this area some time ago, but it's still very relevant today. So like I said, informal work exists in Australia, and for those of you who don't know, it differs from precarious work and insecure work because it operates outside the regulatory system. It's otherwise known as black economy work, cash in hand work, and I'm not going to ask you to put up your hand if you've actually employed a cash in hand cleaner or a labourer or a gardener, but I'm sure many of you know what I'm talking about. Around the world, there's about 2 billion people employed in the informal economy. And the size of the economy, the informal economy in Australia, is said to be much smaller than in other countries. However, there are problems with measuring the size of that economy. As you can imagine, a lot of this type of work is hidden. And so the figure ranges from 1.5% of GDP to 14%. I'm not going to debate the size of the informal economy today, but I will tell you that the Australian government thinks it's a big problem and they want to tackle a significant, pervasive, damaging and growing issue by establishing what we now know as the Black Economy Task Force. So because we know very little about this type of employment in Australia, and we know even less about how it impacts people's health, as part of my PhD, I've undertaken a study of the health of informal workers in South Australia. And the setting for this work is in the area that Catherine has just talked about, although it does extend to some of the surrounding municipalities north of Adelaide. Through this study, what we've learned is that informal employment is a feature of our labour market, and it's as much a feature here as it is in other developed countries. It may not be as, the size of that labour market may not be as large as it is in some of the lesser developed countries, but it is a significant problem here. There are many reasons and many complex and interrelated reasons why people participate in the informal economy. The least of those, I would say, is through choice. There are many push factors that operate at a systems level that leave people with very little choice but to seek out informal work in our own backyards. I can tell you that through this study we know that it involves people who come from across the social hierarchy. So I have engaged with people who have multiple university qualifications through to people who didn't finish year 12. And it involves people who work in a very wide range of occupations. Often it's intertwined with precarious lives, so there are multiple issues that people are experiencing socially, personally, health-wise. And also that largely informal workers in Australia, or certainly in the cohort that I looked at, experience unfair and indecent employment and workplace conditions, and often experience a very reduced level of power in their position in their employment situation. This gives you an indication of the kinds of occupations that people are employed in. So the people involved in my study were doing construction and labouring, gardening and home maintenance, hospitality, retail, arts, agriculture, childcare, range of wellbeing services, IT, body piercing, domestic cleaning, recycling, entertainment, driving and delivery. almost everything you can think of, and I was quite surprised at the breadth of these kinds of professions. There are both employer and employee arrangements, as well as self-employment. When we start to look at the health of informal workers that were involved in the study, we see some really interesting things, and this shows you the self-reported health status of our study participants. And while there are a number of participants who reported their health as being excellent, very good and good, there are a large proportion of people who rate their health as fair and poor, and certainly more than when you look at the South Australian population data as a whole from 2018. And importantly, when we look at the physical and mental health component scores, so the physical is in yellow and the green is the mental health, you can see the wide range of self-rated health scores here. In a population like South Australia, we would expect to see around 50, a score around 50. And what you can see there is that particularly in relation to mental health, we start to get very low scores for mental health status. If we look at the kinds of workplace conditions that informal workers experienced, they're grouped here under physical, chemical, ergonomic and psychosocial exposures and risk factors. By no means am I suggesting that formal workers are also not exposed to these types of hazards, but the big point of difference with informal workers is that there's no protection for them and there's no mechanisms that will support them to address these kinds of challenges. When we asked informal workers about their perceptions about how informal employment that affected their health, these are the range of physical and mental health conditions that they've reported. And you can see again that these are quite a broad range of physical health conditions and very concerningly mental health and social wellbeing issues as well. So just to conclude, that's really a snapshot of some of the data that's been collected for this study. It shows you that there are real challenges for society and governments in how to create fair and decent employment conditions for Australia, for all Australians in a rapidly changing labour market. Informal work is a really pervasive issue in our society, and as I said, many of you will probably know people who've engaged in this kind of work. I know I had a stint at it once as an undergraduate. But when it becomes an entrenched and a dependent type of employment for people, it really does challenge and create lots of concerns for health and well-being. Thank you.
Thanks, Miriam. I suspect that's going to be a discussion that we want to have a whole lot more conversation about over the next few years. So now we have an opportunity to hear from Belle Townsend, who particularly has been looking at this issue of paid parental leave, and we'll hold questions again.
Good afternoon, everyone. I also want to start by acknowledging the traditional owners on whose lands we're meeting today and pay our respects to the elders past, present and emerging. So I'm going to focus my talk on the lessons from a study which has been looking at agenda setting for Australia's first national paid parental leave scheme. And in particular, we were interested in the role of health and equity arguments in getting that scheme up. So just to situate this within the CRE, I've been leading the program of work on agenda setting, and the guiding question that we've had is, how can we make health equity a political and policy concern of government? And as Fran outlined earlier, we've had 3 case studies in this agenda setting work, paid parental leave, the Northern Territory intervention, and trade policy. And these are three policy domains that are outside the health system and the medical system, but they all have clear ways in which they shape people's health. And so today I'm going to focus on the findings from paid parental leave. So just by way of background, in 2009, the Australian government announced its first legislated national paid parental leave scheme, and this was to provide 18 weeks pay at the minimum wage to eligible primary caregivers on the birth of a child. And this was considered at the time a landmark social policy because until 2009, many women workers in particular had no access to paid leave. And that meant that they had to return to work early, perhaps when they hadn't yet recovered from childbirth, or they had to leave the workforce with financial implications for their families. And in 2013, there was a small add-on with an additional 2 weeks, what they call dad and partner pay, to provide men and secondary caregivers with some form of paid leave. And this model was designed so that the government-funded scheme would be topped up by employers, that employers would voluntarily add some additional periods of paid leave for workers. And there were three clear goals in the implementing legislation. PPL, the Labor Party announced, was designed to improve women's labour force participation, to improve gender equality, and to improve the health and well-being of mothers and babies. So 10 years on, we've seen that evaluations of the scheme have shown improvements in these areas. So more than 750,000 parents have taken up the scheme in the last 3 years. A 2014 evaluation demonstrated that parents were taking more time off work to care for their children, and that the rates of mothers returning to work was increasing. And there were also improvements for maternal health and opportunities to breastfeed, and this was in particular for women in low-skilled and low-income work. But while the scheme has had some successes, I think it's important to assess how we've been faring internationally. So Australia was one of the last countries in the OECD to introduce a paid parental leave scheme, and that was one of the reasons why we were interested in understanding why it took so long. And while we know the scheme has had a number of benefits, we're still falling behind the OECD average for the duration of paid leave available to parents. So in the OECD average for mothers who take a mix of maternity and parental leave, we're looking at 52 weeks paid leave available, and dedicated father's leave in the OECD is on average 8 weeks. So we're falling significantly behind the other OECD countries in what we provide. And part of this can be explained by looking at our public expenditure. So again, we fall quite behind the OECD average on what we through government spend on paid parental leave. But we can also explain this by looking at inequities in what employers have offered. So as I mentioned earlier, we have a hybrid scheme. We have a government minimum wage payment, and then expectations that employers will top this up with their own paid leave. But 10 years on, there's been a stalling of this. And so in Australia, more than 50% of employers don't provide any paid leave. And there are big class inequities in who has access. So if you look up the top, we've got education and training. More than 80% of employers, for example, in the higher education sector, are offering some form of employer-paid parental leave. But if you look at retail trade or accommodation and food services down the bottom, most employees don't have any access, and so they just have access to the minimum. And so what this means in Australia is, as a country, if your parents work in what is considered to be a low-skill sector, then your family doesn't get the same period of time together than other families who work in different forms of sectors. And the question is that fair as a country that we have these growing inequities, or do we want to have a more equal society? And there's also another gap that's emerged over time in Australia, and that's also the gender gap in who has access to paid parental leave. So a number of countries have actually designed their schemes to improve equal gender take-up of paid parental leave. And so in Australia, we've found that 95% of people who take up the primary caregiver leave, the government-funded leave in Australia, are women. And that makes sense because they're recovering from childbirth. But more than half of fathers don't take the 2 weeks, and there are a number of financial and cultural reasons for this. But men are experiencing a number of barriers to actually taking up leave, and we're not seeing those barriers in other countries. And I think it's worth acknowledging that this doesn't have to be the case. And so the Icelandic model is one example of what is possible with a government that's actually implemented a number of policy innovations to try and promote greater gender equality in taking care for children. And so here you're looking at a graph of the division of daytime care between cohabiting parents in Iceland. And in 1997, Iceland had introduced 3 months paid leave for women and the option to transfer that some of that to men. But what you see over the time of a child's first 33 months of life is that most of the care is taken by mothers. Hardly ever is it mainly taken by fathers, and there's a slow uptake in equal care. But what they did in 1997 is they said, okay, we want to have 3 months paid leave for mothers, but we're also going to introduce a dedicated 1 month's paid leave for fathers. And so national surveys revealed a few years later that that's actually led to improvements. So if you look at the middle line, in terms of parents taking equal care was significantly improving, and reliance on mothers was decreasing. And then finally they decided, well, we're going to improve this even more. We're going to have 3 months dedicated pay leave for mothers, 3 months dedicated leave for fathers or partners, and then an additional 3 months that could be shared. And all of this is at 80% wage replacement. And so what you're seeing now, they haven't released the last survey, but in 2009 was again more improvements in gender equality and paid parental leave. So there are examples from other countries in what can be done to improve this. So back to our study of agenda setting, as I mentioned, we were really interested in understanding how Australia's scheme evolved the way it did and what was the role of health and equity in shaping the agenda. And just so briefly, we were guided by a social constructivist approach, recognising that policy actors bring their own values to the policy process that shapes their ideas about what the problem is and then therefore what the solution should be. And we were interested in who the actors were that were driving the agenda, who was opposing the agenda, what were the ideas and arguments being used, and what were the forums in which these debates were playing out. And so what you see here is just a timeline of some of the key events that we constructed from document analysis and interviews. And we went back to the 1970s, but actually in the paper that's due to come out this week in Health Promotion International, we go much further back to the way that Australia's welfare state evolved. So we conducted document analysis of a number of parliamentary Hansard records, media reporting, submissions, but we also interviewed 25 key stakeholders who were politicians and political advisors, senior policymakers, and then representatives from trade unions, industry associations, women's group leaders, and public health associations, who were all involved in the agenda setting processes for paid parental leave, but in particular in the 10 years leading up to the policy announcement. So what we found is 2 distinct phases in agenda setting for paid parental leave in Australia. And the first phase was between the 1970s and the early 2000s, where advocacy for maternity leave emerged out of more women entering the workforce and demanding equal pay and improved working conditions, but it ultimately failed to get on the government's agenda. And this was a battle that was primarily fought out in the industrial relations arena, and a key element was strong employer resistance to having to pay for maternity and parental leave. And the second phase, from 2000 onwards, really marked a shift in strategy and tactics towards a government-funded scheme with the idea of a voluntary top-up from industry. And through the use of a number of framing and coalition-building strategies that I'll go into, ultimately led to the policy announcement, which was implemented in 2011. So when we were exploring why it took so long, we found that there were a number of different structural, institutional and ideational barriers that explained why Australia was one of the last countries in the OECD to introduce paid parental leave. And these can be traced back to, as I said before, some of the institutional structures of welfare that emerged in Australia and have kind of created a path dependency and shaped the way that policymakers think about welfare. So the first is to understand that Australia had a particular gendered employment model, and the historian Frank Castells has referred to this as the wage earner welfare state. So from the Harvester judgment in 1907 onwards, Our employment model has historically prioritised the employment of men in work who have been given a generous family wage to care for their wives and their children at home, and then the idea of having a modest safety net to support them with some payments for those who fall outside of this system. So if you think about in the 1970s, a number of Scandinavian countries really building up their social insurance schemes and introducing quite generous forms of paid parental leave for women and men, Australia really just focused on employment and employment for men as the welfare. And over time, some forms of public expenditure, the introduction of Medicare. But the key point is that women were excluded from this male breadwinner model, and it institutionalised gender inequality at work and was complemented with very little political appetite for expanding our safety net model or for introducing other forms of social insurance. And a legacy of this model was a view that work issues and work issues for women were largely relegated as a private matter. They're to be negotiated between employers and employees in the industrial relations system. But this system was, and it still is, quite highly adversarial. And for decades, there has been a sort of power asymmetry within industrial relations that favours large employer groups, and it's particularly imbalanced against low-income working women. We then identified the prominence of conservative ideas about women in the home as a key constraining factor for decades. And this wasn't just particular conservative party lines. There were conservatives from trade unions, industry groups, and even within women's organisations that viewed women with children should be at home, they shouldn't be at work. And it wasn't until the 2007 change of government that actually some more socially progressive ideas finally came to view. Then we have the rise of neoliberalism in the 1980s, the associated anti-welfare views of within the public, but also within government, as facilitating this resistance that employers shouldn't have to pay for maternity leave and governments shouldn't be increasing their expenditure for welfare. But we also found that there was weak advocacy in this period. So trade unions and women's groups were the ones calling for paid parental leave, but it wasn't really a concerted focus. And there was also a significant lack of evidence. So we talked to academics who got involved in the advocacy, and they said at the time there was no knowledge of who had access to paid parental leave or even what the health benefits would be. So how were these barriers overcome? The most significant shift that we found was a focus on a government-funded scheme, as I mentioned earlier, rather than an outright employer-funded scheme. So in the early 2000s, there were key women figures in the Human Rights and Equal Opportunity Commission, in the trade union movement, in women's organisations, and in the minor Democrats political party who got together and began to push for a government-funded scheme in light of the resistance that they'd encountered over the decades earlier. And these women, along with leaders in the public service, started to build a broad coalition of support, and they decided to strategically focus on bringing in industry to support a government-funded scheme. And part of this building of the coalition was to focus on the framing strategies that they were using for paid parental leave. And in particular, they built up an economic productivity framing that actually paid parental leave was good for the economy, and they talked about the business case, that actually there's a business case for employers to be offering this to women workers. In addition to this, advocates that we interviewed spoke about their need to focus on an incremental approach. So the reason that they introduced 18 weeks pay at the minimum wage only for a primary caregiver was in light of the structural and ideational barriers that they'd encountered, and they thought that if they could bring in an incremental scheme, that they could then build on that over time. And there was also a strong importance of building up that evidence. As I mentioned earlier, there was hardly any evidence in the early 2000s about the benefits of paid parental leave. And we know from in public health that evidence alone is not enough, but it actually played quite an important role in pushing the health case. And advocates we spoke to talked about, at the time, the WHO breastfeeding guidelines being released, which was a recommendation of 26 weeks optimal breast and infant milk feeding. And they said that this was really powerful for them to point to a source of evidence and to argue that there was a health case for paid parental leave. And then finally, the importance of shifting the issue out of, as I mentioned before, that adversarial industrial relations system to a more progressive venue, and this was a key strategy that advocates identified over this period. So, for example, in the early 2000s, they decided to run an inquiry in the Human Rights and Equal Opportunity Commission, and this was a strategic attempt to take it away from just being about employment, but for it to be about gender equality and human rights. And then 5 years later, the ALP tasked the Productivity Commission with investigating the benefits of paid parental leave for economy, health, and gender equality. And advocates told us that this was a legitimising strategy. It was a way of involving more actors and more framing arguments to shape the agenda. And then finally, as I mentioned earlier, the election of at the time, a more socially progressive government in the Australian Labor Party provided a key policy window for bringing about change. So many supporters within the ALP were on board between 2000 and 2007. So once they won the election, they were ready to support the inquiry by the Productivity Commission. So there were some interesting findings on the tensions between the framing arguments that were used to push for paid parental leave. And the first was that all three framing arguments for economics, for gender equality, and for health were needed to get paid parental leave over the line. Health was uncontested. Nobody disagreed with the health benefits, but it often wasn't seen as the successful argument on its own. And there were also tensions between the health argument and the gender equality argument, whether this was primarily about women or was it about gender equality between women and men. And I think many of these tensions continue to play out in contemporary debates with the issue of lack of access to father's leave in Australia. Equity was seen as an underlying rationale for many, but it wasn't seen as central to winning the debate. And the efforts by advocates to reframe the economic case, many spoke about that as particularly powerful, but it wasn't enough on its own. They needed to also have the health arguments and the gender equality arguments with the economics. So I think it needs to be pointed out that the paid parental leave from our interviews, it was always seen as an incremental first step. It was the intention of policymakers that the scheme would be further developed. So in 2009, the Productivity Commission in its inquiry, for example, said that there should be a review in future years for the idea of compulsory employer superannuation pay, but that hasn't yet come to fruition. And then we've got the issue of extending the leave. So the 18 weeks at the minimum wage that we currently have for a lot of workers falls below the WHO guidelines. And as I showed before, we're falling behind the OECD. So 10 years on, we have a scheme that has had some successes, but we're also falling behind with inequities along class lines, but also along gender lines. And this was the subject of a forum that, a national roundtable that I co-convened at the ANU last month, where we brought together some of the original architects of the scheme and policymakers and academics and a number of health associations and trade unionists to reflect on what the next steps might be for Australia. And it was interesting that one of the core tensions that emerged in our roundtable that we didn't quite move on from was whether we want to take incremental change or do we want to take transformative change. So with the government of the day, do we just want to tinker with the edges and see if we can get a little bit more for fathers? Or do we want to think about looking at transforming the scheme and implementing some of the models that other countries have, for example, employer-wide levies on contributing to paid parental leave? And I think what was interesting was that with the stakeholders in the room, there is an appetite to pursue both of these depending on where you sit. So we have a number of policymakers and trade unionists and academics who can all each work on these aspects in their own way so that we can have, I guess the idea would be some tinkering, but also some push for a transformation and evidence building for transformation. So if there is a window of opportunity in the future, then the evidence is there to push for a better scheme going forward. So what are the lessons for what we could call paid parental leave Mark 1? I've pointed to the importance of broad coalitions, so public health advocates working across the table with trade unionists and other groups that you wouldn't perhaps necessarily immediately identify, of using different framing arguments, of understanding that sometimes the equity framing works, but sometimes you need the health and economic framing with you, of building up that evidence, but also of thinking about the different venues and forums in which you can advance the agenda and how you might use different framing arguments within those venues. And there are similar themes that are emerging from the other case studies on agenda setting, which would be great to discuss with you in the break. And just to acknowledge the research team behind this case study. And yeah, we've got a paper coming out this week, so if you're interested, I'm happy to share that with you. Thank you.
Stay close anyway. Okay, we do have just a tiny few seconds before those of you that are starving need to run out of the room and get your lunch. And I'd like Miriam and where have we lost them both? Catherine, to maybe come back up as well. If you have questions, can we go back to the, remember, please just introduce yourself and can you nominate who you particularly want to ask the question to. So we do have some roving mics as well, I think, so I can see one down the back there. So questions for any, going down here.
Hi, it's Samantha Bannons from Southgate. I had a question of Catherine. So, with the closure of Holden's, did they offer much transition support, and was there much discussion of mental health and suicide issues? Because with that group, that being male-dominated industries, there's clear links with anxiety, depression and suicide, especially during structural changes.
Yeah.
I just wondered what was offered. And
the actual transition support was really good, and I think they did a marvellous job. It finished a year after the closure though, and there was some discussion as to whether it should have gone on a bit longer, because it's still really playing out in many ways, because people got very, very long redundancy payouts where they don't really show up in any of the data, in the welfare data or any of that. But we also heard from the union support group, as well as the Automotive Transformation Task Force and the Holden Transition Centre, that people were having quite significant mental health issues, really about job loss and what was, especially the older group.
so did the transition support include support for mental health?
Yeah.
Yeah.
Yeah,
Okay.
it did.
Next one. Come on, it can't have been empty. Yes, we're coming down the front. And then we'll come over to you, Tessa.
Michael Bentley, Flinders University, but also based in Hobart. I wonder if there's a connection between Catherine and Miriam in terms of the closure of the Holden factory and the rise of informal work. Have you thought about that together?
We've certainly thought about that, yeah, and that was one of the things we were wondering about. Probably the timing wasn't quite right, I think, in terms of that's certainly a thought bubble. Could that be the case? In Australia, unlike in other countries overseas, we don't collect data about informality, so we really don't know quantitatively how many people are participating in that kind of work. So we couldn't even, look at that down the track in terms of, have we seen a spike there in the northern suburbs of Adelaide around the time of the Holden closure? I did ask my research participants whether they'd ever worked for Holden. Nobody had, not specifically themselves. One or two people had partners who had been employed by Holden in the past, and certainly many people knew about it and talked about the wider community ramifications. But in terms of whether there's actually a direct link, they're not able to show that through the research I did.
I think one of the interesting things about Holden and the workers there is that many of the people who worked at Holden didn't actually live in Playford. So, you probably have to stretch the boundaries of where you would be interrogating people to find that out. And of course, the other thing about informal work is that we increasingly have bunches of people who simply don't have access to our social security system in Australia, and who, of course, are very subject to exploitation and very challenged by that. So, Tessa, I think you were.
Thanks. Question for Miriam, and actually it was going to pick up a little bit on that issue about access to income support. In your analysis, you mentioned that you'd looked at people who are engaged in informal work, both as employers as well as employees. So I was just interested in you unpacking that a little bit more, and particularly whether that sort of challenges some of our assumptions about where the exploitation lies around informal work. And then it was, I was sort of thinking that same question around what does that look like in the context of people's access to social security, particularly around income support.
Yep, so a few things there, I suppose, is that yes, there are both types of work arrangements, so those that are self-employed and those who are working for an employer. I think in terms of exploitation, there obviously would be more, there are more examples of exploitation where there's an employer-employee work arrangement, obviously, I guess, in a way. Having said that, it's also really important to recognise the community as hiring people who are self-employed. And then there's a whole lot of things that can come into play around expectations about a job, how much they're going to pay people, their types of experiences that they have in the community as a vulnerable person going out, for example, cleaning somebody's house, how long that job would take, how much they're going to be paid for it. So the nature of the exploitation in the relationship plays out both in terms of an employer-employee arrangement as well as a self-employed situation where a person is working for a citizen, a community member. Many of my participants were on income support payments in addition to working in the informal economy, which points, I think, directly to the fact that our welfare system does not pay people adequately for them to be able to meet their living costs. That goes from people who are receiving unemployment to disability support to pensions of other kinds. Does that answer your...
No, absolutely, but just a final comment to that. Also, if you think about the activation requirements to receive income support payments, people are having to demonstrate that they're working and presumably they're not including their informal work.
No, they're not. They're not disclosing that information, obviously, because that's going to work against them immediately. If they disclose that, their income support payments go down. And then in addition to that, there's a whole lot of... Well, not a whole lot because I don't have a large sample, but I have very rich stories from people who don't qualify for the welfare system, which is what you were referring to. So I'm talking about people who are on certain kinds of visas, for example, and who don't receive any income support and who are also not entitled to things like Medicare, etc. And those people experience, I think, some particular vulnerabilities in addition to some of the other individuals. Yeah.
One more over there.
Taking up the question about precarious employment and informal work, there's no systemic studies, but it appears to be that the growth of precarious work, which includes self-employed workers, has led in turn in rich countries to a growth of informal work. So the Europeans seem to see an ascension, and I think that's the connection here. So it wasn't the closure of Elizabeth so much, it's been the growth of precarious work which has actually led to a growth of the informal sector. The other big question is that it's not, the regulation in the precarious work is also corroding. So you've got wage theft and things like that. And again, that's systemic. You've got subcontracting as a mechanism for the growth in both areas. And so those connections really need to be tracked through. And of course, you've also had large waves of migration using under dodgy visa schemes, and that has also played into the hand. So there are structural mechanisms here, and they need to be kept into context. But that's obviously not what you're looking at, Miriam, but I guess those are the sort of things you need to take account of.
Yeah, that's right. And certainly those sorts of things are raised by people, not in those kinds of terms, but they talk about those structural drivers. And certainly I'm building in terms of context, but we'll talk about that more, yeah.
probably got time for one more.
I have a question for
introduce
Belle
yourself,
then.
Jen.
Sorry, I'm Jen, University of Melbourne. I ask a lot of questions, sorry. I was curious, you talked about the idea that one of the ways that had been successful in getting this policy advanced a bit more with the paid parental leave was having the different venues and having it be more inclusive in terms of the actors that were brought into it. But I know that in other policy areas, especially around nutrition and obesity and diet, having more people in the room has actually complicated it because they compete in terms of what should be prioritized. So I guess I was curious, did you see that at all, and how did you get that unity and alliance of purpose?
I think so. I think it was over a 10-year period that some of these key actors from government, civil society, trade unions and industry started working together. So I think that they started to have a clear narrative about what it was that they wanted. So I think that was a way of avoiding the clash of all of the different policy options. And it was something that came up in our roundtable about, well, what are the next steps? Do we all need to be on board with one? Is that the tinkering? Or do we transform, or could we do both? Yeah, so that's my thought. And then with the forums, I think the problem was that when it was purely seen within the industrial relations lens, that didn't allow the arguments around the health benefits or the gender equality benefits to be heard. And so opening it up within the Human Rights and Equal Opportunity Commission and then the Productivity Commission allowed those framings to come through and support. So having those other frames worked, whereas perhaps in other settings it can actually detract. Yeah.
All right. Well, at this point in time, I think we probably ought to head for lunch. But one of the things that I am always struck by as I sit in these conversations and as we unpack some of these things is just the sheer issue of complexity. And, you know, you look at a couple of those little pictures that Catherine had in her presentation that is trying to plot the players and the issues and stuff. And there is no doubt that, you know, there is enormous complexity in the middle of it. But one of the other complications that we have is that those of us, particularly sometimes in policy land, get into is that we get fixated on particular bits of complexity and think that that's the thing that needs to change. And the very interesting thing when you step back and you have the opportunity to kind of look at this stuff, it may not be the individual thing that you've been focused on that needs to change or that will be the thing that results in the change. It may be a whole series of other things. And so then trying to, A, have the broadness of vision to see the opportunities that might be there from other forces at work in our community and in our politics, is enormously challenging because we do have a tendency, all of us as a human tendency, to kind of get more and more drawn into what we worry about, and that immediately competes with our ability to take on board all of the other stuff. And, you know, I think that's a enormous credit to the work of Southgate and the work in the social determinants space, is that in fact people are struggling to bridge that. And so when you listen to Ashley's presentation, you know, we're talking about how do you actually build the levers into world trade that in fact result in health positive outcomes at a local level. And that too is complex, but in fact it's a very important question for us to all be concentrating on and not to lose sight of. And not to lose heart about our capacity to actually lever change. And, you know, it may take a lot of persistence and it may take the odd bit of opportunity coming along. And sometimes I wonder about, you know, in all of these areas, what is it that actually creates the crisis? And often crisis is what motivates change. And so is there a crisis around? And the crisis here in the South Australian context, as we've just been talking about, the crisis was about the car manufacturing industry disappearing. But what that led to was an enormous focus on the people who were in the car manufacturing industry. It didn't lead to an enormous focus on what was happening in the broader community of Playford. And so there were enormous resources that went to dealing with the people who were in the car industry, and we see that they haven't always delivered what might have been hoped. But there weren't enormous resources also delivered to the people in the city of Playford that would enable the community to thrive and develop and grow and address some of those broader kind of health issues that are sitting there. So, you know, it's a big job that we all have, but I'm very glad that you're joining us in the journey, and I'm very glad for the analysis that in fact brings some level of accountability to these processes. So can you join me in thanking the 3 of our presenters this morning, in fact the 4, because Ashley is there too. Please go and enjoy a little bit of lunch. We'll be a slightly shorter period. I think we're back here at 1:45. Yeah, find them and ask them the questions that you want.